Eczema and psoriasis are two of the most common skin conditions worldwide, affecting millions of people. If you're one of those struggling to find relief, you may have been prescribed steroids at some point. Steroids have been the traditional treatment for managing these conditions, offering quick relief from symptoms like inflammation and itching. However, with advancements in medical research and treatment options, many are beginning to ask, are steroids still the best solution for treating eczema and psoriasis, or are they becoming outdated? Let's explore the effectiveness of steroids and newer treatments, and whether it's time to consider alternative options for these chronic skin conditions. Understanding eczema and psoriasis. Eczema and psoriasis may look similar on the surface but have different causes and symptoms. Eczema is often triggered by allergens, irritants, or environmental factors. It results in itchy, red, and sometimes blistering patches of skin. On the other hand, psoriasis is an autoimmune disorder, causing the skin to regenerate too quickly, leading to thick, scaly patches that are often painful. Both conditions can significantly impact quality of life, with flare-ups that seem unpredictable and at times unmanageable. Many people have turned to steroids to control these flare-ups, but is that still the best approach? The use of steroids in treatment. Topical steroids have been a staple in treating both eczema and psoriasis. They work by reducing inflammation and calming the immune system's response, which provides temporary relief. For many, the short-term results are dramatic. Itchiness decreases, redness fades, and the skin begins to heal. However, despite their efficacy, steroids come with limitations. As medical advancements introduce alternative treatments, the relevance of steroids in managing eczema and psoriasis is being re-evaluated. The challenges of steroid use. While steroids can offer quick relief, long-term use presents several challenges that patients and doctors alike are wary of. 1. Side effects. Steroids can cause skin thinning, increased risk of infection, and even hormonal imbalances when used excessively or over extended periods. Overuse of topical steroids can also lead to stretch marks and skin discoloration, especially in sensitive areas like the face. In severe cases, prolonged use of steroids may contribute to adrenal suppression, which can lead to more systemic health problems. Patients often struggle with balancing effective relief from symptoms with the risk of these side effects, creating additional stress in managing their conditions. 2. Dependency and withdrawal. One of the most common concerns is steroid dependency. Many patients find that their skin becomes reliant on steroids, and when they attempt to reduce or stop usage, they experience severe flare-ups, often worse than before. This condition, known as topical steroid withdrawal, can be physically and emotionally taxing. Patients experiencing withdrawal symptoms may deal with intense discomfort and emotional distress as they work to wean off steroids, making it harder to break free from their dependency. The anxiety over flare-ups can make some hesitant to explore other treatments, further entrenching reliance on steroids. 3. Decreased efficacy over time. As the skin gets used to steroids, they often become less effective. This means stronger or more frequent applications are needed, increasing the risk of side effects and complications. Over time, some individuals find that they have to rotate different strengths of steroids or even escalate to oral forms to manage flare-ups. This escalating need can limit treatment options for those who have exhausted the effects of traditional topical steroids, leaving them searching for new therapies. Given these challenges, patients and healthcare professionals are now exploring newer treatment methods that aim to provide more sustainable and safer results. Alternatives to steroids, expanding treatment options. There are now several treatments for eczema and psoriasis that don't rely on steroids, offering patients alternative ways to manage their skin conditions. 1. Biologics. Biologics have revolutionized the treatment of psoriasis and moderate to severe eczema. These medications, including Dupixent for eczema and Taltz or Cosentyx for psoriasis, target specific parts of the immune system, reducing the overactive response that triggers inflammation. Unlike steroids, biologics can offer long-term control without the skin-damaging side effects. However, biologics are typically more expensive and may require regular injections. Despite the cost, many patients report significant improvements in both skin health and quality of life, with some even achieving full clearance of symptoms. The personalized nature of biologics also allows for more tailored treatments, giving patients a better chance at sustained relief. 2. Topical calcineurin inhibitors, TCIs. These non-steroidal creams, such as tacrolimus and pimecrolimus, offer another alternative to steroids. They work by suppressing the immune response in the skin, reducing inflammation without causing thinning or other skin damage. TCIs are particularly useful in treating delicate areas like the face or eyelids where steroids may not be safe. Though effective, TCIs can cause initial irritation, especially in sensitive skin, and require careful application to avoid flare-ups. Still, TCIs are generally safer for long-term use and can be combined with other therapies to enhance treatment outcomes. 3. Phototherapy. This treatment exposes the skin to controlled amounts of ultraviolet, UV light, slowing down the rapid skin cell growth in psoriasis and reducing inflammation in eczema. Phototherapy is typically performed under medical supervision and can be highly effective, but it requires consistent sessions over time. For individuals with moderate to severe psoriasis, phototherapy can dramatically reduce symptoms and offer sustained relief. However, long-term exposure to UV light raises concerns about potential skin damage and an increased risk of skin cancer, so close monitoring is essential. 4. Natural remedies and lifestyle changes. For those who prefer more holistic approaches, some patients find relief through dietary changes, natural oils like coconut or sunflower oil, and stress management techniques. While these methods may not replace medical treatments, they can complement them and help reduce flare-ups. Research into anti-inflammatory diets and mindfulness practices suggests that lifestyle adjustments can play a meaningful role in managing chronic skin conditions. However, the effectiveness of these natural remedies varies from person to person, and integrating them with medical treatments under professional guidance is usually recommended for best results. Are steroids becoming outdated? Recent advancements in biologics and other alternative therapies suggest that steroids may not be the best long-term option for everyone. Research shows that biologics, in particular, offer longer-lasting relief with fewer side effects, especially for moderate to severe cases. For those with milder conditions, newer non-steroidal topicals and phototherapy can also provide effective management without the risks associated with steroid overuse. That said, steroids remain a valuable tool for acute flare-ups or when patients need immediate relief. The rapid action of steroids can help control sudden outbreaks of eczema or psoriasis, offering a short-term solution while other treatments are introduced. However, the evolving landscape of dermatology is leaning toward more personalized, targeted treatments that aim for sustainable, long-term skin health. As patients become more informed, many are choosing to transition away from steroids in favor of therapies that offer less risk and better outcomes for the future. Summary: steroids versus alternative treatments. Steroids remain a popular option for short-term relief from eczema and psoriasis symptoms, but they come with significant drawbacks like skin thinning, dependency, and decreased efficacy. Biologics, TCIs, phototherapy, and natural therapies offer newer, safer alternatives, with biologics showing the most promise for long-term control of inflammation. As research continues, steroids may become less central to treatment, especially for those with moderate to severe skin conditions. Share your experience. We want to hear from you. Have you used steroids for eczema or psoriasis? Did you experience any side effects or challenges? Were you able to find relief through biologics, phototherapy, or natural treatments? Sharing your story can help others feel empowered to explore new treatment options or better manage their current regimen. Whether you're just starting your treatment journey or have years of experience, your insights could offer valuable guidance to others facing similar struggles. Drop your experiences in the comments below and let us know how you're managing your condition. And for more insights into skincare, stay tuned to our next video. Until the next one, stay informed, stay active, and most importantly, stay healthy.